I am Thaloso Lekopanye and I am your host. Welcome to Botsogo Boswa. Today I am at Princess Marina. I will be with Dr. Kebonye Motseosi, an expert in child care. We will be talking about immunization. So let's go inside. Hello doctor, kindly please introduce yourself and what you are really focusing on.
Okay, thank you. My name is Dr. Kebonye Motseosi. I'm a pediatrician at Princess Marina Hospital under the Ministry of Health. I'm also a member of the Boswa Pediatric Association. So I deal with children. I take care of children.
Right. So today we'll be talking about immunization. So can you kindly tell us what immunization is and the importance of immunization?
So immunization is a process in which human beings' body is fortified against infections. So vaccines are medications that we give that help protect the body against certain diseases. So mainly most of them are injections, but there are some vaccines which can be taken as a pill, and these help the body to protect themselves when they get infection in two ways. So it either helps prevent somebody from getting the disease, or it prevents the disease being severe. So for example, a flu vaccine, it doesn't necessarily mean that the person won't get a flu, but if they do get, or when they get the flu, it is not as severe as if they hadn't gotten the vaccine. So the importance of that is that the population of children, particularly those under 5 years, are at a higher risk because their immune system is still immature and they can get very serious illnesses that can affect their growth, that can affect their bodies, and some of them can also lead to death. So that is why it's very important for children to be vaccinated against certain illnesses.
How bana should take that mokento at the age of 5 years old?
I'm saying the demographic ya bana ba ba kota se ga ngwaga tse 5 years ke bone ba ileng gore re focus ta mo go bone, mme mekento ya thibelo bolwetse or immunization e rana up until 13, even school going children. So mo Botswana go na le an immunization schedule. The first vaccines are given at birth. So ngwana ha sena go tsholwa go na le mekento e mebedi leng gore wa ihima e leng gore thibela ya nta thibela against TB, e nngwe thibela against bolwetse bo bitswang go hepatitis B. And o ta lemoga ha o ka bula karata ya sekali e na le mekento eo ya gore e tsamaya jang. From first vaccinations at birth, the next set of vaccinations is the 2 months, and then the schedule follows that, and then it also goes to the school going children because le bone gona le a set of vaccines se leng gore ba di. So not just 5 years, so from birth.
So you know the side effects, because most of the parents they believe or it has side effects. Maybe you can clarify on that issue.
Everything that we do has side effects. Le melemo mengwe e re enwang e na le side effects, and so santlha ka gore ke mokento, side effect ya ntlha ke bothoko jwa mokento. And then at the site of the injection go kgona go nna le a bit of swelling or some redness. Mekento e mengwe kgona go dira gore mogote wa ngwana o e go godimo. Most of the side effects are very mild and ga di diege lobaka mo mmeleng wa ngwana. It na about a day or two, and then e be tokagala. Ga se gantsi re bona di side effects tse leng gore di kwa hatsa ngwana thata. Mme ha motsadi a lemoga ngwana a nna le dikaedipe tsa sa di twaelang, re rotloetsa gore a ye go tleliniking kwa nako ke la mme gaufi le ene gore a bone thuso. Mme bontsi jwa mekento e re hang di side effects tsa yone ke bone gore pain ha ngwana ke ntibeng teng nako tse di mo kgona go nna le mogote, le bone ko dikokelanong ba rutuntshiwa ka gore ba lebelele
So what happens if a child doesn't take this immunization? Mokento kana atudisa go tsaya one mokento go diragala eng?
Go na le nako tse leng gore ngwana o kgona go tola mekento ka gore kana kwa teng go ngwana a lwala kana gone go motsadi a sa kgona go ya kana go e tshwanetseng. ngwana ha tudilwe kana silwe ke mokento wa gagwe o kgona go tsa kana go engwe mme go na le mekento e mengwe leng gore ha dikgwedi tsa yone di hitile go ga se thola kgona gore a itsee ke ka ha se ka mokento wa rotavirus ha ngwana a hitile mala dikgwedi tsa teng go na le ha a ka tewang go teng ga ka go thola a o hiwa gape mme ke ba bongaka baoki ba leng gore ba ka tsa tshwetso eo ya gore go ngwana kwa teng e setse e hitile mme ngwana ha tudilwe ke nako ya gagwe a le 3 months mme a tudilwe ke mekento ya go ya 2 months ba bongaka ke bone ba ba ka tlhalosang gore a o ka o tsa kana jang jaanong batsadi ha ba tudilwe ke nako ya teng sa bone ke go ya kokelanong ya gautshwane gore ngwana a ka hiwa mokento o jaaka re tlhalositse bo thokwa jwa mokento ke go thibela gore ngwana a tsenwe ke bolwetse jo leng gore ra dirile ka go bothibela kana ha a ka nna le bolwetse jwa teng bo se ka jwa mokoahatsa thata.
All right, Motsana ko lapeng, catch us after this break as we'll be continuing on the topic of immunization. Welcome back to Boswa, and we are still continuing on the topic of immunization. I am with Dr. Motseosi. Dr. Motseosi, there is this myth this immunization, it can cause infertility. How true is this?
Immunizations are safe. So before immunizations are given to the public, there are certain trials that are done to ensure safety. Other than infertility, which I actually haven't heard about, worldwide there's been concerns about vaccines causing conditions such as autism, but there's no data to prove such allegations. Vaccines are safe to be given and they are beneficial to children. They are beneficial to the community as well because children can also spread some illnesses to adults. There's illnesses, conditions such as measles that adults can also get. So vaccination is not just a childhood protection, it is a lifelong protection that the community benefits from as well.
And there's this issue they have this fear. So how do you deal with such issues of fear?
It's important to understand the importance of the vaccines and why it is important for parents to vaccinate their children. It is to prevent illnesses in their children as well as prevent severe illnesses and sometimes even death in children. The first most important thing is to educate. Health promotion and education is very important. So you'll notice that in clinics they do health promotion and try to teach parents about the importance of these vaccines. As per the Botswana under 5 monthly weigh-ins, there's teachings that parents are given so that they understand the importance of good feeding practices as well as immunizations.
Where can parents access the immunization services?
So the immunization services are provided at childcare welfare clinics. Ha bana ba ya sekaleng ke gone go ba hiwang mekento ya bona. Ya ka ke tlhalositse motsadi o ka lebelela le ene mo karateng ya sekali mo pageng ya ntlha di kwadilwe tsotlhe ka ha di latelanang ka teng. Go na le tse leng gore di kwadilwe be go nna le mo go eteng go di special campaigns mo neng gore gongwe go ntshiwa letsholo la gore go kentelwa sengwe kana go hiwa mokento kana molemo o thibelang bolwetse bongwe le yone e teng ho government kana Ministry of Health o ntsha molaetsa wa gore bana ba dikgwedi tse di rileng kana go eo ba ye go hiwa mokento wa teng kana molemo wa teng. Me di kokelano bontsi mo Botswana di ha di vaccine. In the private sector they also provide vaccines as well.
You can touch a little bit on the preparations. How should they prepare the puppies?
In terms of preparation, there's not much that goes into it because ngwana wa baya sekaleng, and so a well prepared child is clean, well fed. Ba leng gore ba santse ba breastfeeder, I do sometimes advise gore gongwe ka nako ha ikentiwa aba ahiwa mashi a gagwe kana ahiwa lebele, because that is soothing to help with the pain that is usually associated with the injections. But it can be before or after, but it just helps to soothe the child. And just also batsadi le rona re sa tshoga, because they pick up on our fears as well. So if we are fearful about the injections, they can sometimes pick up on that and they'll be anxious because of that. So the parent being calm and playing with the child to distract the child can help make it a less scary or traumatic event.
Thank you so much, Dr. Motseosi. Motswana ko lapeng, catch us after this break as Dr. Motseosi will be giving you some message, some packages. Welcome back to Boswa. We are still on the topic of immunization, and now Dr. Motseosi will be telling us on how the community can get awareness in this issue of child immunization.
My message to the community is that vaccines are important. They help prevent diseases and help protect everyone, the children themselves, as well as the communities that they're in. Vaccines are safe and side effects are usually minimal, but where there is concerns about any adverse effects, please go to the nearest health facility for any help. It is important for us to understand why we need to give vaccines, which vaccines we need, and when they need to be given. And that is information that is readily available at healthcare facilities.
Thank you so much, Dr. Motseosi. Motswana ko lapeng, that was Dr. Motseosi for you under the topic of immunization. So gakologela motswana wetu, take this topic of immunization seriously. Don't have any fears like you had from Dr. Motseosi. Remember, this is the end of our program. Stay safe and stay protected. Thank you. Until we meet next time.